Welcome, I'm Dr. Thacker. I work over the Med Group. I've been there for almost 20 years. Let's see, and do I understand that, and I'm a pediatrician, do I understand that a lot of you are new to the CDC, is that correct? Or all of you or something like that? Okay, so you haven't seen this presentation before. They've asked me to go over with you the medication administration. So there's several things we'll go over with that, some different medications and how to do it, those kinds of things. Okay. Any of you with medical background? Some? Okay, good. Any of you with kids? Okay, good. Alrighty. Let's see, so I think that, we'll just go right with this. Change that. Okay, so here's some of the things, just an overview of what we'll be going over today. Different medications, and then we'll go over concussions at the end. Okay, 6 types of medication. There's just kind of an overview of that. We'll go through each one of those. Want to make sure you have all the right things here. Okay, first of all, you got to make sure you have the right person, right? Make sure they're who you think they are. Do they wear armbands here? No, just know who they are. Probably a good idea to have them say their name if they can. A lot of the younger ones can't, obviously. And you have to make sure you have the right medication. They can get mixed up easily. That's very important. So read the label each time and make sure it's not expired. Every time I pull out my blood pressure medication, I look at that and make sure I have the right thing, the right dose. Okay. Okay. So those are the first 2 rights. Make sure you have the right dose. Read carefully, a tablespoon versus a teaspoon. We're trying to get away from using those 2 names. We're trying to use mLs instead. It's less confusing. mL and a cc are the same thing. A drop versus a spray. Make sure you read that label correctly. Make sure you're giving it the right place, in their eyes, and their ears, and their mouth. Okay. Sometimes we have eye drops that are given in their ears, so just make sure you read that carefully. Make sure you have the right time. Military time can be a bit confusing. So 14:30 is not 4:30, it's 2:30. So just pay attention to those kinds of things. And the right documentation. I think you have a form you have to write down. All the medication that you give. So, who can remember the 5 rights besides this one?
Person, medication, route, dose, time.
Excellent. Good. Okay. Okay, poison control number. I'll give you 10 seconds to memorize this number. Okay, what's the poison control number? Okay, good. 1-800-222-1222. Yeah, remember that I've called that several times with patients that I've had. Okay. Next, storage. Okay, I think you have a fridge up front that you keep medication in. Okay. You don't want to have food in the same fridge. And of course you want to separate oral meds from the topical ones. You don't want to keep it locked. We're not going to. Okay, so we'll go over these different types of medication administration. Okay, if you miss a dose, if you remember right away, still give it within an hour or 2. But if you forgot completely, you generally just resume with the next time. Okay? Some of that depends on the medication. Oral medication. Again, check the amount carefully. 1 ml is the same as 1 cc. 5 ml is about a teaspoon. Usually shake the medication. Most antibiotics need to be shaken. And give it by a syringe or that's usually the best way to give it. You can usually measure it the best by a syringe. It should come with one of those syringes to give it. let's see. So topical medication, diaper creams, maybe applied for a rash, not preventative. Diaper creams on the approved list can be used with parent permission. And you have that list, right? Approved creams. Okay. And then the lotion, sunscreens, and insect repellents can be applied if parent signs the permission forms, but special eczema creams need to have a prescription to use those. Okay, eye drops. Always wash your hands with any medication. This is especially important with the eyes. And for putting in eye medication, and if you have a real small child that's rambunctious, you may need some help to hold them still while you do that. They have them lie down if needed. Pull down the lower lid. It makes a little bit of a pocket right there to put the medication in, whether it's an ointment or whether it's a drop. Put it in there and then let it go, and it will typically bathe the eye. For drops, it's good to kind of steady on the nose or the eyebrow to put those in. Okay, for eardrops, have them lay on their side. Put the eardrops in there, the number that's on the bottle, number that says to do. Try to keep them there for a few minutes, or you can put a cotton ball in the ear to kind of help the medication stay in place. Okay, let's talk about some specific medications. First one's albuterol, which is given for asthma. Asthma can be pretty scary sometimes, especially for the child that's experiencing it. They're short of breath. You might be hearing an actual wheeze, which is kind of a when they're breathing out. That's typically what you hear. You might see some retractions. That means it kind of tugs in between their ribs when they breathe in. You see the skin kind of caving in, or right here, you might see that caving in right there. That might be a sign. Lots of coughing. Hard time speaking in full sentences. It can be a sign too. You just are very short of breath. So those can be some signs. So what albuterol does is, a little bit about asthma first, is that it causes, I like to say, kind of twitchiness of your airways, where they kind of constrict, get smaller, so you have trouble pushing out that air, so they trap air. And what the albuterol does, it helps kind of relax those muscles around the airways so that they open up better. Let's see. So albuterol helps with that. It's given as an inhaler. There's some side effects. Increased heart rate is very typical, jitteriness, irritability. So I'm going to show you that right now. A couple different ways to give albuterol. So this is a spacer. Inside this is actual medication. So here's the canister of medication that fits here in the dispenser like that. Now this can be given just like this. It comes through there in your mouth, but it's usually more effective to give with a spacer, because more of it will get in your lungs instead of it being deposited on the back of your throat. So this is a spacer. This is one kind of spacer. There's several different kinds. So it will just go on there, and then here's the mouthpiece that goes in your mouth like this. So the way to do this, a typical dose is 2 puffs of medication. You want to shake this up good before you do it. Now, if you haven't used this for a while, or if it's the first time, or if it's been a couple weeks since you've used this canister, you want to prime it 4 times to get it flowing well. Put it in there. Again, shake it up good. So what I'll be doing is if the child is old enough that they can cooperate with you, have them breathe out, and then as they put their mouth on there, you push the medication, and then have them slowly breathe in. So I'll kind of try to demonstrate that a little bit better. So shake it up, blow out, And then try to hold it for a few seconds before they let it out, because that will give that medication more time to work. Okay. Now if you go too quickly with this one does this, you get the harmonica, and that means it's too fast. You're breathing too fast, and they'll get that deposit on the back of their throat instead of going into their lungs. I don't know if all the spacers have that, but that's what this particular one has. So that was one puff. Wait about a minute, and then do the same thing again, and that's 2 puffs. That's the typical dose for albuterol. Okay. Usually the peak effectiveness is in about 20 minutes, and it depends on how bad they are, what you do from them at that point. If they're having serious problems, then you're going to call 911, of course. Okay, questions about that? That's the inhaler. I was going to show you this part too. A lot of your kids that are smaller kids are not going to be able to do that for you, to coordinate their timing. So we have a mask. We should have a mask that goes on it. And so you do all the same thing, except that you won't be able to time it with their breathing. So you just put it to their face, dispense the medication, and then hold it to their face, over their nose and mouth, until they take about 6 breaths. And if they're crying, that's okay, because that will just help them get the medication even better. Okay. So that's for the younger children if they need that. Okay. The other way to give albuterol is with a nebulizer. And what the part that I don't have here is the actual machine that this connects to. But basically, it just sends air, and you just flick it on. But I'll show you the rest of the setup here. This is what your medication goes in. It's usually the medication is usually already mixed in saline, or just in a little vial that you'll put in there. So you unscrew this, squirt the medication in there, close it back up again, and try to keep it upright while you're doing all this. Then this goes on here. Piece that goes on here. This piece that goes on the other end. And this is from the air source. So again, this other end just attaches to the machine. And it will put air into here, comes out this tube right there. Aerosolizes the medication, that's liquid medication that's in there, so it makes a mist, and then the mist will come out through here. And then the idea is for them to inhale this medication, so they'll just kind of try to do the same thing in getting that down into their lungs, try to hold it for a little bit. And when this medication is going, when the aerosol is coming out, you can see the mist coming out this way. And a good way to prompt them is to try to get them to make that disappear, to get them all into them instead of coming out this way. That's a good way to prompt them. As they breathe in, it'll come this way. So that's a good way to coach them through that, if they're old enough to do that. Yeah. But if not, again, you just kind of have to hold this by their face. have them breathe that. Okay. All right, questions about that? Okay. Let's see, let's go to the next one. Okay, EpiPen. EpiPen is used for severe allergies. Okay. And allergies can have many manifestations. Here's some signs here. Hives, facial swelling, difficulty breathing, generalized fishing or itching, or kind of searching for something. That's what fishing means. They're looking for something. You don't necessarily have to give an EpiPen for every allergic reaction. It's for the more severe ones. Like if they just have some hives, maybe just a dose of Benadryl will be fine to treat the problem. But I always tell people that if you ever have a question and you're not sure, go ahead and give the EpiPen, because you're not going to hurt them. It might make their heart rate go a little bit faster, but you're not going to hurt them, and you might save their life. Okay? Generally, this right here, the difficulty breathing, that is definitely a sign of a severe allergic reaction. And generally, if you have more than one system involved, like you have, say, hives, and they're vomiting, a couple different things, then you probably ought to assume that it's more serious. Go ahead and give it. This next slide, I think, is some good pictures of hives. Hives are, they're not just a lot of little dots. We sometimes get reactions to medications that look like that. But hives is different sizes and shapes, raised rash. So these are good pictures of different sizes and shapes. And they can occur all over. They can occur in a few places. Those are hives. Okay, use the EpiPen. Pull the cap off. Well, look how she's holding that right in the middle. Because you want to stay away from the pen. You don't want to poke yourself. That's not a good thing to do. So you'll place it right here over the outer upper thigh. Swing back and then a firm pressing that into the thigh there, and pressing in like that triggers that needle to come out and then an injection. Okay? Hold it in place for 10 seconds so that allow the medication to deliver. If you ever use this, you want to call 911 because it has a short duration of action. You can repeat it in 5 minutes if you need to, if they're still having symptoms, but you want to get the emergency medical team on their way to respond. Any questions about EpiPen? Talk about hypoglycemia. Here's some signs. Hypoglycemia you typically see in a child with diabetes. Because they have their insulin that they take, and the idea of the insulin is to make their blood sugar down to normal. Sometimes they might get too much, or they might not get enough food. If they're sick, they might not get enough food to cover that insulin. So it'll just drop it lower than it should be. And here's some signs of that getting too low. Tremor, increased heart rate, irritability, sweating, confusion, change in consciousness. Now, if you have a child that's just kind of jittery, but they're awake, they're alert, able to swallow something reliably, then the best thing to use is maybe 4 ounces of juice, orange juice or apple juice or something like that, followed up with a more complex protein, something with meat or cheese or something in it, and some crackers, something like that, so it'll last longer. But if they have a decrease in their consciousness, if they're not alert, then that's when you go to glucagon. Uses this medication. So we'll talk about that. So glucagon is a medication that, again, brings up their blood sugar again. If you have a child that has diabetes, I encourage you to look at this beforehand, kind of get familiar with it beforehand, because when you're right in the moment, you're shaky and it's hard to think at those times. So just kind of practice it through your mind so you're familiar with what to do. This particular box, usually they have some pictures on there. It's just 2 things in the box, the medication and then the syringe. It's like it's showing you flip the cap off of the medication. And there's fluid in here that then you inject into the bottle, swirl it around till it's all mixed up, and then you use the same needle to withdraw it out again. The way you give this is any place where they would get insulin. I can give it in their abdomen, in their arm, in their thigh, any of those places. You just go in a 90-degree angle, just put the needle all the way in, and you inject that. Usually they respond within 15 minutes. Now, if you have someone who's not conscious and you give them a glucagon, I wouldn't automatically assume that they're going to respond like you expect them to respond. So call 911 again so that they get there and can respond in case there's some other reason why they're that way. But once they do become conscious again, you want to feed them something to help keep it up. Questions about glucagon? Oh, there's one more way to give glucagon. There's a new intranasal way of giving it, and I think there's one child, might be at the center, that has this. It's just an intranasal one that is kind of a plunger that you plunge in. Take off the wrap, insert it into their nose, and then inject it firmly into their nose. Probably a lot less anxiety producing on the part of a caregiver to do it that way. Yeah. Okay. That's another way to get that. Nice website there to more information. Okay. Seizure medication. Again, this child should come with instructions, and they would bring this medication to you to have it on hand. This is given in their rectum. You put the person on their side, bend their leg forward, with the top leg, and insert the medication, insert the syringe. Again, push it in over 3 seconds, leave it in for additional 3 seconds, and then take it out another 3 seconds to hold their buttocks together so it has a chance to absorb without leaking out. And then again, you continue to observe the patient. This is given for a seizure that is continuing. Most seizures will be over briefly. You won't have to do anything for. You just kind of watch them, make sure they're breathing fine and the color's good. But one that is persistent, and again, they'll come with instructions, particular patient, of what that time is. It's often, say, 5 minutes that they're still seizing, and that's when you give this medication. Again, if you have to use it, you call 911 and call their parents so they know what's happened. Okay. Observe and make sure they're okay. Okay, this is not medication, but something they wanted us to talk about in concussions. The best way to describe a concussion is an injury to the brain. You can't see anything if you do a CT scan. Say it's kind of been shaken up. So those forces have caused the brain not to work quite right. Here's some common features. Usually rapid onset and short-lived. It can be longer. They have no structural injury. And it usually follows a sequential course as far as recovery. Show you some signs. Here's signs of concussion. I'll just read those down. Vacant stare, delayed responses, inattention, disorientation, slurred speech, perseveration. Perseveration means doing something again and again without purpose. Not coordinated, nausea, vomiting, memory problems, loss of consciousness. Signs and symptoms. What signs are is things that someone else noticed, something that you will notice about them. The difference between that and symptoms is that symptoms is something that they complain about themselves. Headache, feeling slowed down, trouble concentrating, dizziness, fogginess, fatigue, vision changes, light sensitivity, memory problems, balance problems. So those are some signs and symptoms. What to do for a concussion? Mostly you get them to rest. You take them out of the situation. You sit down, lie down. Whatever activity they're involved in, if they're involved in sports, they need to sit out for a bit. And they need to be evaluated. They need to get some medical attention. Usually and then as far as going back to those activities, there's usually a graded process we have them do over a minimum of 6 days. We call that a return to play protocol. So like the first 24 to 48 hours, they do nothing. We have them rest physically, we have them rest cognitively, don't even do anything mentally stressful either, just rest. No TV even, just kind of rest. And then we gradually have them increase the activity. They might do some light exercise or and gradually increase. If at any point along that progression they have a return of symptoms, you don't want to have them do any of this until their symptoms are gone. If they have a return of symptoms, then you have them go back to the last step. So that's what we usually do. We supply them with a schedule to increase their activity. Sometimes, most of the time, concussions, they get over those, they're fine within a few days. Sometimes they can have more long-lasting things, and they have to get therapy for those things. And so, just kind of a summary. Can be obvious or more insidious. Well, lots of different symptoms. Most resolve without problems. This is what we talked about. Some can be more long-lasting. I think that's the end of my presentation. Do you have questions? A lot of stuff to think about. Hopefully you don't have to use EpiPen very often. Okay? All right. Thank you.